Tonight, we are yet one more step closer to COVID booster shots for all adults.
Yeah, late today, a group of CDC advisors said they support expanding the boosters to everybody 18 and older. So now it's up to the CDC director.
And it comes at a time when we've been seeing COVID numbers rise across the state.
Yeah, we've seen nearly 4,000 positive cases for the third straight day here in Indiana. And this is a trend we're seeing all across the country. But there are some questions tonight when it comes to getting another shot.
So our Gina Glaros went straight to the doctor to ask some of your most asked questions.
We haven't even hit the holiday weekend yet, and the cases have started to rise.
Dr. Shuchi Talwar is a primary care physician at IU Health, and she's answering our questions. The first, how long after getting your vaccine series should you wait to get your booster?
At least 6 months after completing your first set of series.
It's 2 months for Johnson & Johnson. Is there a grace period? How long is too long to wait to get your booster before you have to redo the vaccine series?
Because you already have the immunity built up with the initial series, there's no set grace period.
But the doctor says if you wait too long, you do risk lower antibodies. How long will the booster be effective?
And that's what we don't know. So the biggest thing with that is as we find out what that sweet spot is in terms of how long the antibodies last in our system or how quickly the virus is evolving, that will guide in terms of how quickly or after their booster shot do we need a repeat one.
Is it safe to get a flu vaccine and the booster? Does timing matter? She says you can get them same day, same arm, at the same time. Can you mix companies?
They have seen that the antibody response is equal throughout with all three of them. So it doesn't matter. You can get any of them.
Which is considered the most effective?
The studies have shown that the Moderna antibodies may be lasting a little bit longer.
All three have kept patients out of the hospital. Will side effects be similar?
It's really different with each person. I will tell you myself, I did feel like it was about the same as my second shot. It was really body aches, fevers, etc.
IU Health requires an appointment with walk-ins on certain days. Some pharmacies are also doing walk-ins. You need your ID and vaccine card.
We're doing pretty good on vaccination supply. That's not a concern at this point. The production has been really great. That's no longer a concern.
The CDC said more than 31 million people here in the U.S. have received a booster shot as of yesterday. Of course, there have been lots of discussions about the vaccine, and the doctor told Gina she's seen more people grow hesitant about getting other vaccines, but she says it's still important to get those shots.
There's a school in Muncie that's now switching to remote learning after an increase of COVID cases on campus. The Burris Laboratory School sent a letter to parents saying there's a rise in cases and in quarantine. So the school making the decision that they will have remote learning as well as pause all extracurricular activities. This includes athletic practices and games. They're coming back to the classroom on November 29th.